Welcome to This Is How We Heal with naturopath, herbalist, and author Anthea Koulouros. With over 3 decades of clinical experience guiding thousands on their healing journeys, Anthea invites you into honest, heartfelt conversations about what really gets in the way of health and healing and what gently brings us back to ourselves. If you're sick and tired of feeling sick and tired, overwhelmed by wellness noise, or just yearning to feel like yourself again, you're in the right place. This podcast is for anyone feeling burnt out, lost in a sea of symptoms, or simply longing for a deeper connection to their health, their body, and their truth.
Hello and welcome to This Is How We Heal. I'm Anthea Koulouros, naturopath, and someone who has spent many years sitting with patients, navigating some of the most complex health journeys imaginable. Wherever you are right now, walking, resting, driving, or simply pausing in your day, I am so glad that you're here. This is a space where we slow things down, where we look at health and healing with curiosity rather than certainty. Today, I'm continuing to share more content from the book that I'm currently writing. This section feels particularly important because I think it speaks to something a great many of you may recognize. I called this section Comorbidities and Multimorbidity, the interconnected challenges of multiple health issues. It's about what happens when it isn't just one thing, when life hands you not a single diagnosis, but several, layered on top of each other, tangled together, each one influencing the others in many ways that no single specialist has quite managed to explain. Today, we're talking about comorbidities and multimorbidity, about what it means to live in a body carrying multiple chronic conditions at once, and what healing can look like from inside that complexity. The longer I consult, the more I see patterns. Year after year, referral after referral, and patient after patient, each person bringing their own unique expression of increasingly familiar clinical stories. There is the woman in her 40s with fibromyalgia, anxiety, and irritable bowel syndrome who has been told each diagnosis is completely separate. The man with type 2 diabetes, depression, and sleep apnea who takes 7 medications and wonders why he still feels terrible. The teenager with endometriosis, chronic fatigue, and a history of trauma whose symptoms have multiplied faster than anyone has been able to keep up with. What I see in my clinic again and again is comorbidity and multimorbidity. In simple terms, the presence of 2 or more chronic conditions at the same time. And with those, often a fleet of pharmaceutical drugs that go hand in hand. These conditions are chronic because they have been present for a long time, often crossing multiple systems in the body. One condition aggravates another. A medication prescribed to manage symptoms of the first creates side effects that require a second prescription, which then creates its own complications. This chain reaction can be exhausting, both for the body and for the person living inside it. Why does this matter for healing? Because these overlapping conditions create an interconnected web of challenges that complicate treatment, prognosis, and daily life. They demand a more nuanced, more coordinated approach to care, one that sees the whole person, not just the tangle of diagnoses. Without that wider view, healing can be slowed or even stalled entirely. When multiple conditions exist together, they rarely sit neatly side by side. Instead, they tend to interact, sometimes subtly, sometimes dramatically, creating a complex web of cause and effect. Diabetes can accelerate the progression of cardiovascular disease. Chronic inflammation from autoimmune disease can predispose someone to osteoporosis. Depression can heighten the experience of chronic pain, while chronic pain itself can deepen depressive symptoms. A feedback loop of illness where physiological stress, immune dysregulation, and hormone imbalance continually reinforce each other. And the interplay isn't only biological. The psychological toll of managing multiple conditions, often with multiple specialists who may not be communicating with each other, adds another layer of strain entirely. The mental load of remembering medications, tracking symptoms, and attending appointment after appointment can lead to overwhelm and burnout. And these emotional states in turn influence health outcomes. Chronic stress impairs immune function, worsens inflammation, and slows recovery. It's a cycle that feeds itself. Over time, this web of interlinked challenges reduces what I call resilience, the body's ability to bounce back from stress or illness. Energy reserves dwindle, recovery times lengthen, even small setbacks can trigger a cascade of symptoms. For many of the patients I see, it is not one diagnosis that defines their health journey, but the exhausting scrum between them all. I want to tell you about a patient. I'll call her Dee. Dee is a young woman whose medication regime and list of diagnoses would be more at home in an elderly patient's chart. She has undiagnosed endometriosis and a long history of disordered eating. Her way of coping with the deep scars of childhood abuse is through her disordered eating. She moves from doctor to doctor, specialist to specialist, and clinic to clinic, searching for answers. On paper, it can look like doctor shopping or practitioner shopping. In reality, she's desperately seeking someone who can see her as a whole person. Each specialist narrows their focus to a single organ, a single system, a single symptom, and entire pieces of her health story are left discarded or overlooked. Dee has come to identify herself as broken, in constant need of fixing, in constant state of being a patient. Her life is shaped around being the patient, continuously seeking relief, validation, and hope from yet another appointment. But she's exhausted by the cycle of symptoms and the burden of medications and supplements, and by the revolving door of healthcare. More than anything, she just wants to feel normal again, symptom-free, doctor-free, drug-free, and she wonders, what would happen if I just stopped everything? Perhaps, could she untangle herself from the web of dependency? Could she find her way back to herself? This is the question she brings to me, not in so many words, but in the unspoken longing that is palpable between her sentences. Untangling a case like Dee's requires more than putting out the spotfires of individual diagnoses. It calls for stepping back, seeing the whole landscape, and finding the threads that connect each piece of her health, her history, and her identity. It requires integration, and it requires time. When someone presents with multiple chronic conditions, the greatest gift we can offer them is integration, a space where all parts of their health story are seen, valued, and connected, rather than scattered across separate medical files. True integrated care means developing shared care plans that consider the whole person, their physical, emotional, social, and spiritual needs, not just in their diagnoses. Research consistently shows that patients with multiple chronic conditions often experience fragmented, uncoordinated care, which leads to worse outcomes, reduced satisfaction, and the burden of management falling squarely on their already weary shoulders. As a naturopath, my role is not to replace medical treatment. It is to work alongside it, to stimulate the innate wisdom of the mind and body to heal, and to identify the common threads that may be contributing to ill health. In many patients, those threads include chronic inflammation, gut microbiome imbalance, nutrient deficiencies, hormonal dysregulation, and lifestyle factors like poor sleep, high stress, and reduced movement. But I also want to talk about something I've come to call threading the good, because one of the biggest shifts in my clinical approach over the years has been to stop chasing every underlying cause at once and instead weave together the foundations that are already strong: nutrition, restorative sleep, movement, supportive relationships, and from that stable base, gently tending to the areas of ill health that need more attention. Rather than handing a patient an itemized list of everything that is wrong with them, we anchor them first in what is working, in where they already have capacity and success. This is not about minimizing complexity. It is about making healing something a person can live with rather than another thing to feel imprisoned by. For me, untangling always begins with creating capacity, freeing up energy, confidence, and space to heal. because without capacity, even the most brilliant treatment plan is just another burden to carry. Creating capacity might mean simplifying a patient's routine, reducing unnecessary treatments, reordering priorities so they can focus on what is most healing right now. It means helping someone reclaim small pockets of physical energy, mental clarity, and emotional latitude. And from that foundation, beginning to rebuild. And beyond capacity is what I call rewiring, the gradual conscious process of teaching the mind and body new ways of relating to health. For patients with long histories of illness, the neural pathways of vigilance, symptom watching, and fear are deeply established. Healing asks us to gently create new ones. Rewiring can look like practicing daily rituals that signal safety to the nervous system. It can look like cultivating language and thought that affirm possibility rather than reinforcing an illness identity. It can look like engaging in whatever brings genuine joy, connection, and meaning, not just as a luxury, but as medicine. Capacity is the first step. Vitality is the next. Capacity creates the space for the body to heal without being constantly depleted. Vitality is when that energy becomes available for living, not just for managing illness. When a person can begin to imagine their life beyond the boundaries of medical appointments, prescription, and symptom diaries, that shift in perspective is, in many ways, the most profound form of healing available to us. So before I leave you today, a few questions to carry with you. As always, these are not for immediate answering, but for sitting with gently over time. How do your different health conditions affect one another? Are there patterns you've noticed that your healthcare providers haven't connected? Which common threads run through your health picture? Inflammation, sleep, stress, gut health, or something else? Where might you be able to simplify, to do a little less, but with greater intention and care? What foundations of your health are already strong, and how might you build from there? And finally, how do you describe yourself in relation to your health? Is illness part of your story, or has it become the whole of it? What would it mean to hold it a little more lightly? Thank you so much for spending this time with me. This is a topic close to my heart because I see the weight of it carried by so many people. And I believe deeply that a different kind of care is possible, one that sees the whole person, not just the collection of diagnoses. If today's episode resonated, I'd love to hear from you. You can find me at apothecabyanthea.com or Anthea Kalura's social media on all the different platforms. If you know someone navigating the complexity of multiple health conditions, please share this episode with them because it might be exactly what they need to hear today. So until next time, please be gentle with yourself, and I'll see you in the next episode of This Is How We Heal.
If this episode spoke to you, your healing journey doesn't have to end here. Join Anthea in her dedicated online community, the Staying Healthy Together Club, a space for real conversations and holistic health education with trusted resources. We'd love to see you there.